Assalamualaikum warahmatullahi wabarakatuh. Good morning, viewers. Hopefully, you are always in good condition. With me, Raditya Kevin, here in the morning coverage of DCC Global News, which this time will be completed about very dangerous outbreak of Covid-19 or coronavirus disease 2019. Coronavirus or Covid-19 has been declared the world's pandemic by the WHO. Coronavirus is a zoonotic or virus that is transmitted between animals and humans. The virus and the disease are known to have originated in Wuhan City, China since December 2019. As of March 21, 2020, the number of cases of disease reached 275,496,000 inhabitants in 136 countries, including Indonesia. Public Health Guide for Covid-19. This guide aims to the community and health workers in order to reduce and break the spread and the severity of the disease and the death rate of Covid-19 in Indonesia. Operational definition. Appendix 1. Unsymptomatic person or OTG. People who are unsymptomatic and have a risk of contracting from a positive person COVID-19. People with symptoms are closely contact with the positive case of COVID-19. People in monitoring or ODP. People with fever above 38 Celsius or fever history or symptoms of respiratory system disorder such as cold, sore throat, cough, and in the last 14 days before rising symptoms have a history of travel or reside in countries or regions that report local transmissions. People who experience symptoms of respiratory system disorder such as cold, sore throat, cough, and in the last 14 days before rising symptoms have a contact history with a case of confirmation of probable COVID-19. Supervised patients PDP. People with acute respiratory infections or ISPA, fever above 38 Celsius or fever history, respiratory accompanied by one of the symptoms or sign of respiratory disease such as cough, shortness of breath, sore throat, cold, pneumonia mild to severe, and in the last 14 days before rising symptoms have a history of travel or stay in the country or region reporting local transmissions. People with fever above 38 Celsius or a history or fever or ISPA and in the last 14 days before the symptoms arise have a contact history with the case of confirmation of probable COVID-19. People with heavy ISPA or heavy pneumonia that require hospital care and there is no other cause based on a convincing clinical picture. Cover your mouth when coughing and sneezing with upper arms and armpits or with tissue, then immediately dispose of the tissues to the trash and immediately wash hands. Immediately change clothes, bathing, arriving at home, after traveling. Clean and periodically disinfecting the objects that are often touched and on the surface of the house and furniture such as tables, chairs, and etc. Increased immunity and controlling compost beds in the fight against COVID-19. Maintaining a self-immune system is important, especially for controlling composure. There are several things that can improve immunity in people who are exposed to COVID-19, namely as follows: balanced nutrient consumption, physical activity like gymnastics, rest enough, vitamin E supplements, no smoking, control of compost bed, such as diabetes mellitus, hypertension, cancer. In the home and restrictions on the use of public transport. Social restrictions in this case is to keep physical distancing which can be done by first, not adjacent or physical contact with people. Regulate the closest distance about 1 to 2 meters. Not to be close with him or her. Number two, avoid unnecessary use of public transportation such as trains, bus, and uh, others. Avoid busy hours when you travel. Number three, work from home, if possible, and the office enforce this. Number four, mass gathering is prohibited in the crowd and public facilities. 5. Avoid gathering friends and family, including visiting or sharing face-to-face with postponing activities together. Contact them with phone, internet, and social media. Number 6. Use your phone or online service to contact your doctor or other facilities. Number 7. If you're sick, do not visit the elderly if you live one house with them. Then avoid direct interaction with them. Everyone must follow these terms. Regulations or policies that have been set by the government, of course, are very influential on all sectors, including the economy and social life in the community. Based on the information in this media a few days ago that approximately 50 million people were threatened to lose work due to the effects of coronavirus pandemic or Covid-19. It is difficult to imagine in case of unemployment then social problems will continue to emerge. However, it is all to be underlined that whether the government does is as a form of concern for its people because it prevents it's better than cure. In addition, the effects of the influence of coronavirus or Covid-19 in the social life of society. Among them is the onset of suspicion and loss of confidence in people who are in awe or we are just familiar. For example, when we buy food, both in label stalls and 5 feet, we'll definitely find out it's clean or not, whether the waiter is in contact with the infected person or not, their officer or servants who wash their hands at the time of processing the food that we order or not, so that a doubt arises. When we are guided or met both in the office environment and in the home environment and with the local community, we are reluctant to shake hands even though they are parents, as we teach our children to always respect the older. However, the current situation requires us to avoiding shaking hands and should keep a distance of 2 meters. When wanting to talk to others, let alone people we don't know, to obey the appeal in a meeting requires that we wear masks, but on the other hand, there are also those who do not use masks. Even cough carelessly, this certainly raises suspicion. We sometimes quickly judge. This problem will certainly make the concerned feel offended, especially if anyone says that it's corona. CO workers necessarily leave it or keep it away. The coronavirus has crippled the world economy, including Indonesia, as in everyday life among lower middle class, such as grocery merchants, fish vendors, and vegetable traders. They felt the decline in the purchasing power of people due to the inconvenience of consumers in shopping. Another story of a driver who usually can fulfill the needs of his or her family, but with the spread of coronavirus case, the community is reluctant to use public transport. The government's encouragement for lockdown or self-quarantine each home with face-to-face activity at schools, college, and office doesn't all comply with it. Even some who use self-sufficient quarantine time to enjoy the holidays. It is It is certainly a problem not only for yourself but also the community, so it's need awareness of self-safety and the environment, prevention of viruses. Immunity plays an important role in keeping the body from the one of the disease-causing microorganisms. Balanced living and nutritional patterns are factors that affect your immune system to function properly. The body has a complex immune system and is divided into two, namely the innate immune system and the adaptive immune system. The built-in immune system is a form initial defense involving surface barriers, inflammatory reactions, complement systems, and cellular components. Meanwhile, the adaptive immune system works after being activated by a built-in immune system and takes time to provide stronger and more specific defenses against pathogens and form immunological memory. The body condition affects both the innate immune system and the adaptive immune system. Consumption of food with balanced nutrition that is rich in vitamins, minerals, and proteins can boost the immune system. Healthy life boosting immune pattern. Healthy living patterns are known to boost the immune system naturally. Some of the healthy lifestyle strategies that can be applied include enough rest, consume fiber foods such as fruits and vegetables, conduct regular exercise, maintain ideal body weight, no smoking, reduce consumption of alcoholic beverage, take action to prevent infections such as frequent hand washing and cook meat until cooked, reduce stress. Boosting the immune system requires complete process. The interactions of a range of cells with their respective functions is useful for responding to various germs that attack the immune system. However, until now, no experts or research could get the answer. Immunity, age, and stress. The ability of human immune system response decreases with increasing age. Consequently, the body is more susceptible to infectious disease until increased cancer risk. Although the level of life expectancy in developed countries continue to increase, there is a relation between age and immunity. Decreased immune response to infections is generally notable from how vaccines work in elderly people. For example, an influenza vaccine given people over 65 years old cannot work optimally compared to vaccine given in children aged 2 years and over. Nevertheless, the administration of vaccines proved to reduce the risk of flu disease and the deaths of elderly people in comparison with unvaccinated groups. Viewers, currently hand sanitizer has become a rare item due to the rise of coronavirus. Hand sanitizer serves to synchronize the hands of the germs that have been attached to daily activities. Well, this time I will invite you to make your own hand sanitizer at home with simple materials. So this is how to make hand sanitizer. All you need first alcohol 70%, aloe vera gel, essential oil, agar glass, stirrer, bottle spray. Here's how to make a hand sanitizer. Pour alcohol 70% as much as 100 ml into a notch glass and add aloe vera gel as much as 300 grams. Stir the two ingredients till they are thoroughly blended. After the mixture is blended, average 15 drops of essential oil the mixing mix well. Pour the solution into the bottle spray. Voila, homemade hand sanitizer is already finished. How easy isn't it? Good luck. The audience, besides trying to maintain the health of oneself and praying highly recommend this critical MSA, as quoted from Shahriyatus Salihin Hadith 1484, narrated from Anas R.A. Rasulullah once read the following prayers, which means, from Anas radiallahu anhu, the Prophet Muhammad sallallahu alaihi wasallam say, prayer, O Allah, I really take refuge from the disease of the disease, crazy leprosy, and from the ugliness of all kinds of disease. Rasulullah felt the need to take refuge to Allah subhanahu wa ta'ala from their illness because of fear of not to able to resist patience, or result then because impatient we are trapped in anxiety and injured to as to loss or of reward of goodness. The news of today finally. Hi Raditya, Kevin. Please. So it's the news today. I'm Raditya, Kevin. I hope we always in protection of Allah subhanahu wa ta'ala. A few of the DCC global news. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh.